Imagine receiving a health alert about a virus spreading in your area, only to later discover that the data behind that warning was fundamentally flawed. What if the very algorithms designed to protect you are actually putting you at risk? It sounds unbelievable, but a hidden threat lurks in eye-driven analytics bias. This insidious force can warp data and lead to catastrophic decisions. Picture this: a small town suddenly labeled a high-risk zone for a health crisis. Panic ensues, businesses suffer. But what if that chaos was triggered by incomplete or incorrect data? This is just hypothetical. Real instances demonstrate how biased data has led to overreactions, causing unnecessary fear and disruption. At the core of this issue lies the data itself. Algorithms often rely on historical data to predict future outcomes. If that data reflects a biased viewpoint or lacks diverse demographics, the predictions become dangerously inaccurate, resulting in misguided public health initiatives. Consider a community with limited resources. If health officials depend on skewed data, they may misallocate funds, overlooking those who truly need assistance. The ripple effect can be devastating. The urgency escalates when we realize that decision-makers may not even recognize these biases. They trust the data implicitly, believing it safeguards us, but it can just as easily endanger us. You might start to wonder, who's really monitoring the monitors? Even more concerning, marginalized communities often get overlooked in these analyses. Their realities may be absent from the data, leading to neglect and further disenfranchisement. So, what can we do about this? Simply trusting technology isn't enough. We must demand transparency and accountability in how data is collected and analyzed. It's essential to scrutinize sources and challenge the narratives we're being fed. Think about this: what if the next health alert you hear could have been avoided? What if we could ensure that the data guiding our health decisions is as accurate and unbiased as possible? As we move forward, we must take action. We cannot afford to be passive consumers of information. Instead, let's engage critically and advocate for a system that prioritizes accuracy over convenience. So the next time you hear a health alert, ask yourself what's really behind the data. Your health and your community's health might depend on it. Have you ever received a health alert that made your heart race? Now, imagine getting a notification that your health data has been misinterpreted due to bias in AI. This is just a plot from a sci-fi movie. It's a reality many people are unaware of. What if decisions about your health are based on flawed data? Picture this: you visit your doctor, and the eye system flags you as high risk based on analytics that ignore your background and lifestyle. Suddenly, your doctor views you differently, and treatments or recommendations are swayed by biases hidden in the data. These biases are creeping into eye-driven analytics, meaning public health decisions aren't solely based on facts, but on distorted interpretations. It's alarming to think that the very technology designed to assist us could also put us at risk. Consider a recent health crisis where an entire community was labeled high risk due to misleading analytics. Many individuals faced unnecessary treatments and intense scrutiny simply because the data didn't accurately represent them. Can you imagine how devastating that is? Vulnerable populations often find themselves at the mercy of algorithms that don't reflect their realities. When a system is trained primarily on one demographic, it overlooks the unique nuances of others. This hidden danger could lead to serious public health decisions that impact countless lives. But there's hope. Researchers are actively working to identify these biases and create more inclusive data sets. The goal is to ensure that AI serves everyone, not just a select few. However, time is critical. As technology evolves, the need for vigilance increases. We must stay informed and advocate for transparency in these systems. Because if we don't, who will? Here's the key takeaway: the data shaping our health decisions should reflect all of us. It's essential to question and challenge what we accept as truth. After all, your health and possibly your life depend on it. If this resonates with you, consider staying informed about these critical issues. Your awareness can spark change. Imagine a scenario where one algorithm determines the health of your entire community. It's unsettling, isn't it? Yet, this is happening more often than we realize, and it all comes down to a factor many overlook: bias in AI-driven data analytics. You might wonder how such advanced technology could pose a threat. The truth is, the very systems designed to safeguard public health can harbor hidden dangers. This issue isn't just about numbers, it's about real lives that can be drastically affected by poor decision-making. Consider a small town facing rising diabetes rates. Public health officials rely on data analytics to pinpoint high-risk areas. But what if the data is skewed? What if the algorithm overlooks entire neighborhoods? This risk is often unconsidered, yet it can lead to underserved populations receiving inadequate care. You might think, surely the experts know this. But here's the problem: the data frequently reflects historical biases. If certain groups have been underrepresented in health studies, the AI learns from that incomplete picture, potentially worsening existing disparities. Let's make it more personal. Imagine you're a single parent in that overlooked neighborhood. The system indicates you're not a priority, but you know your child's health is at risk. You feel invisible, lost in a sea of data, just another statistic that doesn't capture your story. As we delve deeper, let's consider how decisions based on these analytics impact healthcare funding and resources. An algorithm might recommend opening a new clinic, but what if it's in the wrong location? Lives are at stake, yet choices are being made based on cold, unfeeling data. What's the hidden cost of this bias? It could mean delays in treatment for you, or worse, your community being entirely overlooked. The stakes are high as we realize these powerful tools can lead us down a path of inequity if we don't address their flaws. So what can we do? It starts with awareness.